I feel like as a single mom, sometimes we want to look good and we try so hard and focusing in our children that we forget about ourselves. Not to because you want to make yourself look good to please others, but for yourself.
Hi, I'm Sabrina, a licensed massage therapist and certified cosmetic surgery specialist. And this is Talk Plastic Surgery, where we talk about the good, the bad, and the ugly. And today, we are not in the studio. In fact, we are in the spa of someone who is actually quite special to me. Someone that has trained me in a lot of what I incorporate in my own practice. And I have to say, she is a huge inspiration to everything that I do and the reason why I am honestly where I'm at today. So without further ado, please welcome my guest, Jessica. Hey, Jess. Hi. So thanks so much for coming on the show. In the spirit of Talk Plastic Surgery, what procedures have you had done?
So I have done, I would say, I think, maybe 10 years ago, right before I had my daughter, I did Lipo 360 and I did BBL with breast augmentation and implant. So that was a little while then. After I had my daughter, I went ahead and decided to redo my breast because I actually had a capsular contraction. So it was really painful after my daughter, which I feel like also prevented me from giving breast milk. Yeah, it was rough actually. So I had to redo it regardless. I redid that. And I also did arm lipo then after I redid my breast. And from there, that was about 4 years ago. After that, after my daughter, I went back that same year, did chin lipo, and I did buccal fat removal.
Oh, wow. And so you feel like the capsular contracture actually prevented you from being able to give breast milk?
I feel like it played a huge role for sure. I feel like it really did. It was really painful, and I feel like literally my breast was like lopsided. It
Yeah,
was
yeah.
starting to shift and change from all that scar tissue developing and kind of going around the implant. It shifted my breast where it was looking like cricket pretty much, where not only was it the appearance of it was funny looking, but it was really painful. So I had to hurry up and get that redone after my daughter was born. Within like a year, I did that.
Wow. And so then how was your experience when you went in and got that corrected?
Actually, it was great. I had a great experience. It was one of the best experiences I've had than the first time, to be honest. I went, which I actually do want to share a little bit about this. I went to
Please do.
Mexico.
Please do.
So I feel like I'm from Guadalajara. My family's from Guadalajara, Mexico.
Yes.
And I decided to go to Guadalajara because not a lot of people know this, but Guadalajara has the best cosmetic plastic surgery hospital, I believe, within like the region there.
Yeah.
But it's a real cosmetic plastic surgery hospital. Guadalajara is like a very high end city. It's a nice. The experience was great. Where from where you go, most doctors are actually fluent or have good assistance there.
Yes.
So you go there, you talk to your doctor, you meet with your doctor, you plan out and coordinate what the plan is, you check yourself into the hospital. You also have a really nice huge suite to you and whoever wants to be there with you. And I stayed there overnight. The following day, my doctor came in the morning to give me my post surgical garment, which I was going to wear in 48 hours. And I stayed there and I was watched throughout the whole night by the whole like the hospital care and the nurses. And it was a really good experience. And they're there with you the whole route. You can stay there for days. Your doctor's there 24/7 pretty much.
Wow.
So
And
it's
that's
really
when you
nice.
got your breast redone?
Mm-hmm. Yeah, so I went to Dr. Javier Guerrero. He's actually one of the best also. Most plastic surgeons that are actually in this hospital are some of the best ones, and they've been highly trained and have like the best up to date advanced technologies that they use and everything with lipo and everything.
Yeah.
Um, I believe that they can't even just work there; they have to be specifically chosen to work there. So it's some of the best
I
doctors in
love that.
Mexico.
I love
Yeah, it's
that.
like legit. Your
Yeah.
board experience is high end experience. Nice, like like the US. I feel like I wanted to add that because I feel like a
Like,
lot of
honestly, even a little bit better, right?
oh, way better.
Yes,
Way
exactly.
better.
Exactly.
Yeah, way
I
better.
hate that stigma saying that, like, you can't go out of the country and get, like, a really good experience with plastic
Oh
surgery.
no, everything's VIP there.
Oh, yeah,
VIP everything. You speak
for
to
sure.
your doctor's there. Price wise, it was reasonable for Mexico. I will say that it was a little bit more pricey compared to like Tijuana and all those other places which are closer to the border.
Yeah,
But I feel like Guadalajara has some of the best plastic surgeons and it's some of the best work I've seen so far from Mexico.
I love that. And have you had any other surgeries since your breast augmentation or
Um
your redo breast
yes,
augmentation?
actually yes, I did a C-section scar revision, which was a year ago with Dr. Kursandi here at VIP Plastic Surgery.
And how was that recovery for you?
Do you know what? It was actually very easy. Uh, you were there.
Yeah, I was there. I was there. Yeah, you were
um,
back to working right
I was
away.
back to work within 5 7 days.
Yeah.
It was honestly, I feel like the more your body goes through trauma, the more familiar it is. The more familiar it is, where it wasn't really as painful. Um, I feel like I did do it awake as well, which was crazy, but it was a good experience with him too. What was that? I think within, yeah, 3, 4, 5 days I was at work. I did take it slow. I, of course, did my massages. You helped me. I did the taping, which we know
Yep.
what the taping does in between. Yeah, I feel like it really accelerated my process starting within that same day we did.
That's
It-
incredible. Yeah, because
Yeah.
we actually started the taping that night.
You massaged me that night
Yeah,
too.
yeah,
Remember
because
that
you're
when I was
still
out
on
of
drugs
surgery?
and,
Yeah. I
and
was
everything.
like,
I
yeah.
love that.
So
Yeah.
I really liked it. So the C-section scar revision, for those that don't know, because a lot of my clients are not familiar with that, is that
Yeah.
it's pretty much for people that have had a C-sections previously and they want to get rid of that like shaft that kind of, pokes out and it makes it feel like you have like another fupa area.
Yeah.
Um,
100%.
they go ahead and remove it through that scar and bring down your skin a little bit. So I specifically chose that option because I want to have kids in the future. And I also, I don't feel like I'm ready to have an actual tummy tuck where they do the abdominal muscle repair, belly button repair, all that. I just wanted to go with still more natural look for if I do decide to have more kids.
Yeah, and honestly, I think that you being in the industry also kind of helped you heal twice as fast, right?
Yeah, yeah, and make like the best choice on the doctor and what to do. The only reason why I didn't go to Mexico was because my daughter and it was just convenient at the time here. And Dr. Corsandi actually does a really good job as well. So I
He
trusted him.
does. He does do a good
I
job.
trusted him. I think he's one of the yeah, he was my number one to choose. I
Yes.
didn't have to.
And on that note, how long have you been a massage therapist for?
So I would say since 2011, I went to massage school. Consistently being a massage therapist where this is all I do and have been doing, it's probably been about 5 years now.
Wow.
That's all I do.
I love that. And so what inspired you to get into aesthetics?
I feel that the lack of knowledge and the lack of patient care and how to go about having a successful recovery and finding the right person to help you and guide you through your journey. I feel that we lack that, and I feel that based on my education and the things I've studied and everything that I have done, and also me going through everything and my experiences, I'm able to help people and guide them to, create that like successful recovery and support them, giving them like the right things to do because we do lack a lot of that. So
Yeah, 100%.
I felt that really inspired me helping women. I feel that when you look good, you feel good, you perform better in every aspect of your life. And I really love what I do. It's very, it inspires me every day. I feel like I'm not working. I love doing this. And I love to make people feel good. And I love the energy that comes with making people feel good. And, you know, I, I feel like as a single mom, sometimes we want to look good and we try so hard and, focusing in our children that we forget about ourselves, that it's important to also give ourselves that time and support yourself, women and
Yeah.
everything, that,
Yes,
you
yes,
look good. I feel
yes.
like when you look good, you feel
Exactly.
good. Like that's my motto. If you look good, you feel good.
Oh
You
yeah,
perform
100%.
well in everything you do in life. Not to, because you want to make yourself look good to please others, but for yourself, you feel better. You feel good for yourself. And
Yeah.
I love to, give that, and I love to help women, feel that way and encourage them. If they ask me something about surgery, I'm not the one to ask because I'll say, yeah, do it.
Always, always. If there's one thing I always say is
Well,
like,
don't
girl,
ask me.
yeah. If you want that BBL, go get it. If you want to
Yeah.
get rid of the wrinkles on your face, go get that facelift. Like
Yeah.
I'm the number one advocate for surgery. Like I
Yeah.
know when it's my time, I'm gonna be surgeryed up too.
Yeah. Yeah.
Oh hell yeah. And so you teach courses too, right?
Yeah, so actually right now I just started. It's been a little hard here and there, but I finally developed like a ebook with all my education on my experience with working with post-surgery clients. Right now with the few students that I've had, it's mostly nurses and other massage therapists that have reached out from other cities, and I actually had someone from different countries as well. So
Oh, I love that.
yeah, it was pretty cool because she reached out and she's like, no one talks about fibrosis here in Ireland. So
In Ireland.
yeah, she came from Ireland. So
That
I
is that
taught
is
her.
fantastic.
Yeah,
That's
it was pretty. Yeah,
incredible.
I know. She found I don't know how she found me.
The power of social media.
Yeah, so it was cool. I do teach. I'm a little not picky, but I like to make sure with the people that I decide to teach, they have the qualifications or the basic, background where they're a nurse or they're licensed massage therapist, physical therapist or something because,
100%.
you
As they
know,
should be.
yeah.
As they should be.
Yeah, so I only
Yeah.
teach people like that. I do want to expand and continue doing that so that we can, try to bring a higher expectations in post-op care and actually have a good protocol when dealing with post-surgical patients. But right now, it's, here and there, but that's my focus eventually.
Fabulous. And so what are some of your favorite tools to use in your post-op care or post-op treatments?
I like cupping. I do a lot of cupping. I do a lot of cupping at the right time when it's time to actually start cupping. I do a lot of assisted stretching for my clients. As of right now, I think we talked about it. I want to start maybe a little bit of the ultrasound, but I'm very big on like manual therapy
Yeah, for
and
sure.
mostly everything that I do is so I do a lot of cupping actually. I do most of cupping. I love the taping. Taping is my go-to for everything. Taping is magic.
Same. And actually, where did you learn about the tape?
So taping I learned in Brazil with a
Oh.
fit. She's a physiotherapeuta.
And how did you come across that?
I was obsessed. I don't know how I got lucky.
Were you just
uh,
like scrolling and then it just popped up or were you
yeah,
just on
well,
the internet on like Google or
you know
how?
why? I found it because I believe that, with like the massage therapy and everything, we know that KT, taping is so beneficial.
100%.
And obviously, depending on the actual tape and what kind of technique you choose to go ahead and incorporate, it all has a purpose.
Yes.
That I felt that, okay, well, if there's inflammation, swelling that we target for injuries, then at what time is it appropriate to use taping for post surgical swelling? And for lipo trauma.
Exactly.
So I was a little confused at that time where I didn't know exactly when to incorporate that, what type of cut, what type of approach to go about it and doing it correctly for my clients and making sure it actually helped them and not jeopardize any of their results. So I just happened to find her. Like I showed you her.
Yeah.
Showed you
Yes.
her.
Yes, definitely. And
So
actually, like, Jess taught me how to tape. And I'll never forget when I first saw you doing it on social media and I was like begging you. I was like, please teach me your ways.
yeah,
Like I know that this is literally what is going to make like elevate our patients to
recovery
the yeah to
process.
the next
Yes.
level like this and even in my experience using it with my patients and if you guys have watched the show you can hear a lot of my patients rave about it
They love it,
and
yeah.
they
It's like getting a
say
massage without
yeah
getting one.
like yeah like you're there with them 24/7
Yeah, technically.
and it lifts the skin,
Mhm.
it
So it's
lifts the
creating a
skin.
micro massage effect 24/7.
Yes, and
Yeah.
it's honestly it's incredible, it's
It's
incredible.
well, the taping that we do is actually the correct way of doing post-surgical, taping.
Taping.
Yeah, for when after surgery. So if people are taping you with thick strips, bands, and giving you a tight band, somewhat post-surgical style garment, that is incorrect and that is wrong. So I don't think a
100%.
lot of people don't know this. It's
Yes,
very
yes,
common. A lot of people in my
yes,
MS do this.
yes.
I feel that it can help them feel somewhat compressed, but it's not the correct technique where it also jeopardizes the results, can create fibrotic tissue. and create also blistering
Yep, burns.
burns. So
Blistering, burns.
there's
And
a lot of
yeah.
things of going about the tape the right way. So I mean, me and you're probably the only ones that tape like the way we tape here in Vegas.
Yeah,
But it's more
it's because
advanced.
you
It's
taught
so
me.
advanced,
That's
yeah.
why. That's why. It's exactly. And actually, I've gotten some people that have come to me from Miami that were taped up and ended up when I tried to help them take the tape off, they have the blisters on them.
Yeah.
They have the blisters on them, and
Oh
it's
yeah,
it's
all of
sad.
them normally do.
Yeah, all of them normally do, and it's so sad. And actually, I had one lady that came to me, and she was someone had taped her up here in town, and she had just had surgery, and her incisions were open. Like she had Lipo 360, her incisions were open. She had taped over her incisions.
Oh wow, that's sad.
Yeah, yeah, exactly.
Yeah, that's horrible.
Exactly. And so that's why, guys, it's so important when you are doing the tape that you are educated on it. Like if you are not
Yeah.
educated, you should not be doing it because you can hurt your patient.
And it causes from the tension pooling on the skin and that tightness that they're creating that effect when they try to
Yeah.
lift the skin. What they're also doing is they're prolonging your healing because all this swelling that's starting, we have the inflammation, all the swelling, it's being unevenly, how would you say it? It's
Like distributed.
distributed, this
Yeah.
word, yeah, unevenly. And I can actually feel when these women have these specific type of taping techniques and we remove it when that fibrotic tissue is developing
Oh yeah.
based off that type of technique they used in the beginning.
And and actually it's so funny because today I had a patient that um, I taped up her face and
Mhm.
and then she thought she could tape her stomach the way I taped her face because she didn't like her faja. And I was like, girl, why did you do this to yourself?
Yeah.
And then she's just a patient, right? And so when I took it off, she's covered in fibrosis now. And I'm like, and I'm telling her, look, now you have fibrosis
Yeah.
because you decided to just tape up your stomach.
Randomly.
So so
Yeah. Well,
yeah,
that's what
definitely
people don't
you gotta be
understand
careful. You gotta
with
be
what they do.
careful.
Their skin's so pliable. It's healing like the first 2 weeks from the beginning period. It's the most crucial. Like you have to be
Yes.
very careful and really have the right person guiding you and helping you within that time period to make sure you have good results. That's the most
Yes.
important time being.
100%. And so around town, you are known as the fibrosis queen. So, how do you feel like you got that name?
Well, I have definitely have focused. Well, not even focused. I just happen to target a lot of clients now where I've fixed a lot of botched clients, you can say, or people who are
Yeah.
experiencing a lot of hardening or fibrosis overall after their surgery. And at this point, I feel like that's all that I've been having as far as clients. I go ahead and fix their fibrosis from surgery. And it's just, from so many clients that I've dealt with and, giving them the results they were looking for and helping them finally reach to their body to the potential that they were meant to be in. And unfortunately, due to sometimes, it's not the doctor. It's not the doctor.
Yeah.
Due to whatever happened from that time being from 0 to 3 weeks or something like that, is what's gonna pretty much reflect on how you're healing and how the fibrotic tissue develops.
Yes, exactly. And so, how does fibrosis develop?
So there's could be many different reasons, but typically what fibrosis is scar tissue, right? So
Yes.
with
Yes. Yep.
any
Yep. Yep.
surgery, with any surgery itself, we are going to develop chronic inflammation.
Yes.
So it's an inflammatory response, inflammation, which is the swelling, the fluid that we tend to build up from the result of the surgery itself. All that fluid, as we're healing, some of it will become scar tissue. It's inevitable.
Yeah.
Doesn't matter what you do. We all build up scar tissue because that's the body's natural response to healing. We
Yes.
will build up scar tissue. If I hurt my knee and get surgery tomorrow, they ask you to go to rehab and rehabilitate that knee, that injury, because what's going to happen is you're going to build scar tissue
Yeah.
and it's going to decrease your range of motion. It's going to interfere with the way you're walking, the way you're moving. So, what you need to do is rehabilitate that injury itself to make sure it heals correctly. It's
Yeah.
the same concept with liposuction, except that it's an aesthetically speaking selective surgery that we decide to go ahead and
Yeah.
receive. Sorry, it's my mom. You're my daughter. So it's the same thing though. So it's a result of chronic inflammation. However, because of lipo, because of the scars, and depending on the surgery itself, it takes forms, it takes space, and it tends to be classified in different ways. We have cording, knots, uneven bumps. Um, we have different classifications and stages. So at the end of the day, fibrosis occurs because it is a result of chronic inflammation from trauma of an injury, scar
Wow.
tissue in general.
So well said. So well
So it
said.
doesn't matter because it's selective surgery. All our body's gonna heal the same.
Yeah.
It's same
And
body.
anybody can get fibrosis.
Anybody can get
It doesn't matter if
fibrosis.
you had plastic surgery or medical necessary surgery. Doesn't matter if you have an excessive amount of inflammation
It's
within your
inevitable.
body. Literally anybody can get
Yes.
fibrosis.
However, a lot of things from what you do to the beginning healing process is gonna can be preventable to a certain degree.
And preventing,
Yeah,
right?
you can try to prevent
yeah,
it. You can
preventing
catch it as
fibrosis.
it's forming. You can feel it, and what is going on, what is pertaining to making things worse or better for you. The problem's not working out for you.
Yeah.
I also
Yeah,
believe a lot of the post-surgical garments too tight too soon causes fibrotic tissue much faster to develop.
100%, or even lipo or Faja burn.
Yes.
Yes,
That's
yeah, like
any additional
yes.
trauma that prolongs the inflammation phase is what causes the fibrotic tissue. Additional
Yeah,
trauma.
exactly, exactly. And that's honestly why I love the tape too. Because
Yes.
if we could get the tape on you like immediately, then and you can and you're actually able to wear it for a good amount of time when you're out of surgery,
Mm-hmm.
then we can actually prevent you wearing a faja that can actually cause dents and cause more
Uneven indentations, uneven swelling.
yes. And that's honestly why it is so important to go with someone who knows what they're doing and it has their credentials and their licensing to begin with. And so that leads me to my question. What is your opinion on incisional drainage and people pushing fluids out of the incision to drain their lymphatic system, quote unquote?
Definitely incisional drainage and lymphatic drainage are two different modalities, if you want to call that.
Yeah.
Incisional drainage, obviously is more focusing on draining through the incisions,
Yeah.
where the lymphatic drainage is pretty much draining everything towards our lymphatic system to drain through urination.
Yeah.
I do feel that when people tend to open the incisions, it prolongs their healing. It causes additional trauma. Not also you're more prone to infection. Ugly
100%.
scarring.
Yeah. Yeah.
Ugly
The
scarring.
increase of scar tissue.
The increase of scar tissue, because what you're doing is you are pretty much adding more time to your inflammation phase. So what I want to say with that is when we hurt ourselves with a finger and you bump it,
Yeah.
what happens? It bleeds again.
Yeah,
If
exactly.
you hurt a finger that you cut it, it's inflamed, and you hurt it or something happens. It rises again and it's inflamed. The tissue gets inflamed. Sometimes, blood or whatever comes out of it.
Yeah.
So it's the same concept when you're interrupting the healing process and you're performing incisional drainage and inserting something in a wound. You're reopening it, and all it's doing is creating and bringing more inflammation to that area because it's going to fill up again.
Yes, exactly.
So I feel that when the incisions are not open, you do have to target manual lymphatic
Yeah.
system. I don't force anything. I don't push them out. However, I would like to say, because I feel like it's important to add details, because sometimes the way you say things can really cause some type of confusion. And I feel that when I do my sessions, I do manual lymphatic drainage where we stimulate the lymphatic system at 24 to 48 hours. However, sometimes when my clients' incisions are open, I'm still targeting our lymphatic system. The
Always,
incisions
always.
can be open and they tend to drain naturally. I'm not pushing forcefully and I'm not targeting it.
Yeah.
However, with me having my client laying down, everything comes out. Sometimes when they stand up, they just start leaking out,
Yeah.
draining out.
Yes,
Right?
yes,
So
yes.
that's the thing that I also want to, pretty much kind of put out there, because I don't push them. I don't enforce that. If it happens, it happens. If it not, it doesn't. I respect the client's healing phases and healing journeys. And I feel that it's just not safe for someone to randomly insert something in an object or something into you and do that. You are going to drain if you find a qualified massage lymphatic therapist that knows exactly what they're doing. You're going to drain. You're going to have safer salts. Your swelling should decrease each session. And you are going to feel good and get to your expected result without having to go through that additional trauma.
Yes,
And it's
100%.
extremely painful.
It is
I've
that.
witnessed it from my family members. I'm like, what the hell are you doing?
Oh,
What is
really?
that? Yeah. I'm like,
Oh,
what?
like they went and got that. They went and received that incisional drainage.
Yeah, well, I had a family member that was in Mexico and she had hired a nurse and I was on vacation, so I wasn't gonna massage her.
Exactly.
I would have, but I was on vacation with my daughter and she had hired a nurse already. And the nurse was pushing like a in there and just making it all come out. And I was just like, ouch, it was so painful. I mean, it looked so painful.
Dang. And yeah, like have you have you gotten any patients that had received that?
Yes, I had a client I remember. Yeah, I've had a lot, and I always tell my clients I think they know most of my clients. I don't reopen anything, and I explain. I talk a lot. What's up? But I
Yeah.
like to talk and educate my clients because if
100%.
you're trusting me, I want you to be aware of what I'm doing to you and why.
Yeah, exactly.
I'm not randomly doing it just randomly. I am doing these things, and because I do things differently, I want to educate and make sure you know why I'm doing it, so you're also comfortable. But um, I feel that yeah, I mean, I had a lot of them, and I tell them I don't do that, and they know, they know. Most of them know, like, I don't do that, and if they feel like they want me to do that, I always explain to them and tell them, "Hey, this is what I do. This is my results. If you trust me, this is how we're gonna go about it." And
Yeah.
most people that already decided to book with me already trust me,
Yeah,
so they know,
100%.
But
Yeah.
definitely, yeah, that's rough. I've had clients that tell me they put scissors inside of them, and I'm like, yeah, and you can tell, like, the area by the time I get to
Yeah.
them, it's, like, hardening and it's intense,
Fibrotic.
fibrotic, and I'm like, "Oh, man, I have to fix this."
And so every person that you've gotten that has received that, how was their results coming into you?
Mostly at that time being, a lot of them tend to be 2 weeks, 3 weeks. It just depends, everyone heals differently. They tend to to have prolonged swelling and inflammation. I feel that, they do have more, what would I say? More hardening tissue already.
Yeah.
They've already gone through a lot. Most of them are already hard as a rock by the time they get here.
Yeah.
Yeah.
Yeah, that's been my experience too.
They're already
Like,
hard as a rock. Where
yeah.
it could have been preventative is what I'm trying to tell my clients. A lot of clients that come in here because scar tissue does hurt.
Yeah, it
So I
does.
want
Yeah,
to
no,
tell
scar
my
tissue is
clients,
painful.
I want to tell people because this is so important to understand
Yes.
because it's a little stressful when some people that tend to promote lymphatic drainage and tend to talk about it and deal with post-op clients that are not aware of fibrosis or not aware of scar tissue and how people heal correctly inside and out. That
Yes.
what we are doing is a post-rehabilitation method, a protocol where we go based on client's healing process internally, where we will build up against scar tissue and it is manual lymphatic drainage. However, as we're healing, we're doing scar tissue modalities, scar tissue techniques. And unfortunately, scar tissue hurts. So it's not that we're not performing the correct manual lymphatic drainage, water, or whatever the case, Brazilian. It's when you are developing scar tissue and you look somewhat botched, knots, cords, and there's deformities, irregularities that have formed, we need to target them as soon as possible. And it will be uncomfortable. It will be painful. It will burn. It will hurt. I'm
Yes.
sorry.
I'm sorry, but I'm not
But
sorry.
and I have,
Yes.
and it's crazy because I have seen people recently that scar tissue doesn't hurt. Oh, manual lymphatic massage doesn't hurt this that. Okay, but have you dealt with clients that have real cases where I have clients in here that are paralyzed that can't bend down, that can't lift their arm from brachioplasty because all that scar tissue that's tight, decreasing the range of motion. They have
Yes.
severe issues. My clients have I have severe cases of real crazy issues that people aren't even aware of.
Yeah.
And to target that, I have to target the scar tissue first to eventually promote lymphatic drainage.
And it is painful. It's very
So
painful.
I try to adjust based on my clients' tolerance. I try to be very communicative and try to readjust my pressure and communicate with them and change things if I have to, and of course respect them and
Yeah.
their tolerance. But
100%.
unfortunately, it's something that you can't escape that.
No, you can't.
You know, I've had a lot of fibrosis cases I've dealt with, and I try to, go about things differently because sometimes I'm like, I feel bad, and I'm like, I literally, I mean, I sometimes touch clients like this. Look, one finger, like this that I'm doing,
Yeah, yeah.
just one finger. Oh, you have some strong ass fingers, Jess. I'm like, it's not my fingers. I'm not going hard on you.
It's just
It's
their
the
level
way
of
the
pain tolerance
yes, and
at that
also,
time.
yeah, and how you're
Yeah.
healed, the scar tissue, the collagen, the fibers, everything that laid out as the fibrotic tissue developed, because obviously, excessive collagen and all that. How the collagen's laid out, the fibers, I know how to use my hands to move it,
Yeah.
and it will hurt.
Yes, 100%.
So there's a difference with manual lymphatic drainage where they're like it's non-painful. Yes, it's aesthetic. A lot of that whole deep blow detox thing going on right now. Deep
Yeah.
blow detox with manual lymphatic drainage. Yes, for non-post-op clients.
Yeah.
Post-op clients need scar massage techniques.
100%. And this goes back to a lot of things that I talk about is that when you are working with a practitioner and like a massage therapist, PT, OT, whoever is the one facilitating you in your care, if all they are doing is MLD, you are not getting the most optimal care.
Yes.
You're just not, because when someone is healing, they are going through completely different phases. Nobody heals the same. And you can't, this is not a
I
cookie
would
cutter
also like
type
to add
massage.
real quick
Yeah.
when they do the same thing this all the time.
Yeah,
The
exactly.
same
Like
thing all the time.
this is not a cookie cutter thing.
There's no reason why each session,
Should be
client
the
is not
same.
changing and should not be the same. You're not seeing
Exactly.
results, period. If you're not seeing results after each session, you're going to the wrong person.
You're wasting your money.
Yeah.
Yeah. Yes.
Yeah.
Yeah, no, 100%. Because if you are not seeing changes, and and that's why I like to take pictures of my people too. I know that you do too. So that we can make sure that we're actually seeing a change and that we're doing what we need to be doing.
Right.
And of course, when you, like, what is the oldest fibrosis that you've treated?
8 years?
8 years?
8 years, yes.
Wow. And how was that? How was your experience with that?
It was definitely challenging because sometimes I feel like, how capable am I to really, to get this going? Like, can But
Is it possible?
yeah, is it possible
Yeah.
this long?
Yeah.
I mean, I'm always learning. I'm always up for learning. I'm always loving challenges and new experiences. I feel like you're always learning different things. And when I have cases like that, I don't ever say no. And I've always managed to change things and help my clients. And that was an interesting case because after 8 years, I was able to give her at least a 60 to 70% complete change. I looked like I was the doctor. So it was
It's
crazy
incredible.
because,
I love that. I love
literally,
that
like,
so
it
much.
was crazy. I feel like what people don't know is when there's scar tissue left behind, it takes space away.
It does.
Space.
And it restricts movement.
hmm And visually speaking, aesthetically,
Yeah.
space away where it's thick, you don't look to your full potential. So the more you minimize it, the better you're going to look. The less scar tissue you have, the better it is. Every irregularity that tends to form or things that can tend to look uneven and you're not satisfied with can be a buildup of scar tissue that's stagnant and it needs help. So we can encourage a better visual result at the end of the day.
That's awesome.
So yeah, 8 years has been the most. And I was even surprised. But, I feel like I'm pretty confident and I feel like, I can change things pretty much. And, I always go about my clients and their healing based off them. And, I always communicate with them, see how we're doing in the changes. And it was pretty nice actually.
And
It was
how many sessions did it take to get her to that state?
probably average about maybe 10.
Oh, really?
Mm-hmm.
Wow, that's incredible.
Yeah, 10 sessions.
Wow, that's incredible. And was she seeing you like weekly, or was she seeing you more
No, every 72 hours.
every 72 hours?
Mhm.
So then, yeah, so then you have to be like super consistent with it. Like you have to be
Yes.
super on top of it.
Yes.
And is that mainly because you want to really catch the scar tissue from wanting to reform again?
Yeah, so basically I put them on a schedule and a protocol to follow to make sure that everything is changing and we're getting results as we're healing. I can feel everything that I'm doing and that I normally evaluate them and assess them prior to me starting, and everything that I see that's tending to be in the way, I focus on that. And as I'm going through my sessions, I make sure these areas are changing, minimizing, and we're getting changes and making sure that technically everything's draining. Why do I do that? Because in reality, the way that I have my protocol, and the way that I've established to be able to identify fibrosis and help clients with fibrosis is following the 48-hour rule. And that's,
Oh,
I think, my
wow.
rule that I made up. I don't know. Slow down.
You're like following the 48-hour rule,
In my
which
four-
I made up. So now
I
tell me
think so.
about your 48-hour rule.
But my
What is your 48
48-hour
rule?
rule,
Yes.
it's so this is the key. 48 hours.
Oh,
Takes
okay, good.
48 hours for our body to process the lymphatic drainage, massage, and
Oh, that's
stimulation.
right. Yes, yeah, it
It
does.
takes
Yes,
48
MLT,
hours
yes.
for us when cupping to be able to cup again. You can't cup until 48 hours later. 48 hours to flush out toxins with cupping. Takes 48 hours for me to keep the tape on. Technically, I'll keep the tape on 48 to 72 hours. Everything I do is 48 hours and then remove and see the changes from the prior session. And then
Wow,
we go about it. So I follow 48 to 72 hours. Depends how aggressive the fibrotic tissue can be, but 48 hours.
beautiful.
So that's, and that's my rule. Yeah, 48 hours.
I
Because you
love
cannot,
that.
you sometimes when if you promote a lymphatic massage maybe prior to,
Yeah,
it is it can become stagnant. It can become stuck. So the 48-hour rule applies to my clients that are not 2 weeks post-op.
yeah,
Does that make sense? Because
yeah.
typically when we're fresh shot, we do continuously try to encourage that drainage from 1 to 5 days, depending on the client, on a daily basis, to control that inflammation.
Yeah.
And that's pretty much where I start. I also start 48 hours when I start my clients fresh out of surgery, 24 to 48 hours.
Same.
48 hours is the most. Why 48 hours? Because after surgery, as we know, when we have a surgery, um, if you guys can see on the table, oh my gosh, she looks so great. Yeah, she's not swollen yet.
Yeah, yeah, yep. Like the
So
doctor's fresh.
yeah,
Like
freshly
look at
done with
these
the patient.
bodies. Like we just finished doing surgery.
So
Yeah.
what happens is that when we start in 48 hours, we can control the swelling and inflammation from rising, preventing the fibrosis from developing. Why? Because you are trying to control the swelling and inflammation,
Yes.
right? Trying to control the swelling and inflammation to prevent the fibrosis. When we control the swelling and inflammation, we are preventing the inflammatory response from rising, prolonging the inflammation from increasing. So you control the swelling, you control and prevent the fibrotic tissue from developing, from prolonging itself.
And you know what? One thing that I've learned
Oh,
also.
real quick.
Yeah.
Why again, before I forget why it's important. After
Tell me,
any
tell me.
surgery, 0 to 14 days, the inflammation will keep rising.
Coming up.
That's why we start soon and we control it before it. That's the reason.
100%. And actually, one thing I've noticed with my patients too, and with all patients, is that a body that has so much inflammation does not heal fast. So the faster that we could get that inflammation down and under control, the faster that that body can heal.
Yes, that's why it's important also to I like to sometimes do pre-lymphatic drainage massages for the clients that
Yes, pre-op,
pre-op.
pre-op.
I
Yeah,
do pre-op lymphatic drainage to prepare my clients for everything that we're going to be doing. I like to assess them, explain to them what we're going to do, our protocol, and prepare their body for surgery.
I love that.
So,
And do you have a favorite procedure that you like to work on?
no, I like all of them.
I love that.
No.
Yay. And so what procedures have you been seeing the most come into your office?
The most common I would say is Lipo 360 BBL tummy tucks. I do get a lot of intense clients that choose to get really crazy surgeries that are a little bit more hard to deal with, and you have to be really qualified to understand how it works and everything. I've had clients that get brachioclasty coming all the way down to their breasts. I get reversal tummy tucks. I have clients who do pubic lift with thigh lift at the same time and butt lift at the same time. So it all goes from the midline here to the
Yeah.
pubic to the back of the glute too, or sometimes to the pubic. What else? Calf implants.
Oh, wow.
I've had clients who come to me who also
You want calf implants?
mhm.
Dang, that's the one thing I have not had.
calf lipo
I
too.
wow, I do get a lot of I get a lot of calf lipo because I work with lipedema patients as well.
Hmm.
But I have not had calf implants. How
Yeah.
is that? How is working with calf implants? Is it like working with breast implants
Yes,
or
very
butt
similar.
implants?
Yeah, very similar. But I mean, with that, the fact that we use our legs all day and we're on our legs, it's a hard recovery. I mean, you have to walk. It's
Yeah,
intense. It's
100%.
intense.
Can those do you have could those get capsular contracture too?
For the implants, I haven't had anyone. I've had a few of those and I haven't had anyone. But yes, of course, if some part of the capsular contraction is also something happened with the capsular contractions when they develop, something happened in the healing phase that interrupted the healing phase, that scar tissue was created around the implant itself.
Yeah,
So
100%.
anything that, depending on the person heals, if they don't refuse it, reject it, the body rejects it. Things like that. If I had glue implants, I've had a lot of facial work where they shave their bones or jaw lines. Um,
Or like trans as well.
oh yeah, I have a lot of trans clients too.
Yeah, a
Yeah,
lot of trans
that's pretty
patients.
cool. Yeah,
Yeah, I love that.
yeah, and I've actually had really cool cases where I have to fix certain things, and I have to educate my clients. Where I remember I had a client that had fake filler from Korea.
Oh, what?
So she had fillers on her hips. Her insurance was able to cover that, and she was able to get that removed, and they did an actual cut, removed it surgically, and created an incision where I had to and then they grafted fat. I get crazy stuff at the same time. And we had to be very careful how we go about that when the fat transfer and limiting anything from looking too botched.
Yeah, yeah, or
So,
creating dents due
yeah,
to the
the
improper
scar,
filler.
you
The
know,
improper filler
and
too.
then not to mention, with any scar itself, a lot of these scars are eventually, as they're healing, they build up that scar tissue where it can shift and change the way the skin is pooling or changing, that can really interfere with the visual of, the result itself. So
Of what we want.
the what we want, yeah. So, every scar, like we do with tummy tucks, and they tend to form doggy ears.
Yeah.
We have that in any scar. So, the hip scar or anything like that, they'll be like that. So we have to
Wow.
make sure we minimize the scarring. And when the client is ready, go ahead and work those scars and really get that going for them as well.
Yeah. And that's why it's important to know scar massage
Yeah.
because then once it is time, we have to actually dig in there and
Yeah,
work
yeah,
on the scar.
definitely. Definitely.
And actually
Yes.
work on the scar because then we
Yes.
minimize the appearance of the scar.
Yes. And all the scar
Awesome.
tissue thickening that will tend to heal within that.
And so what inspired you to open up your own facility?
Mm, well, I always wanted to have my own place, and I really wanted to go ahead and be able to genuinely help women in everything that I do, and specialize in what I do to really educate the people and really talk about the reality of plastic surgery, and kind of putting everything out there for them and giving everybody a good result, and educating where I think, we'll kind of get there and give them the right what result in general, kind of getting there. I
Yes.
mean, obviously, everyone who doesn't want to have a place, I feel like I want to be a boss. I want to be a boss.
You'd be surprised. It's not for everyone.
I
It's
will
not
say
for
though,
everyone.
I
Yeah.
love what I do. I feel like I'm gifted, and I feel like I'm a healer. I feel
Yes.
like that's my gift. I just fix
100%.
things. I actually have clients that come in here with totally random things, and I fix them. And it's really great that besides the lymphatic and everything that I do, I'm able to really heal people when I touch them in different aspects, that um I really feel like I wanted to put that out there and show people how powerful the power of touch, and how much it can really help you feel better. And manual therapies really can be such a big drastic change in your life when you put that in, and kind of accept it in your life and be a part of kind of getting a healthy approach to your health and everything. So
Yeah.
I really love that. And I feel like, as far as my place in general, though, I do have a really cool concept because it's like a whole little Michelangelo.
Yeah.
Little
And it is very you. It
yeah.
is very you. I love it.
So
I love what you've done with the whole setup and
mhm.
everything. It's
So
beautiful.
it's just simple, and I really liked it. So yeah, it inspired me. I really wanted a nice peaceful place where people can feel comfortable, can feel confident, and I can really help women feel at their best. And that's kind of where I'm at.
That's beautiful, Jess. Awesome. And on that note, let's start some rapid fire questions. So, for question number 1, what do you think of the BBL smell that has been trending around all social media?
I don't think that's true. I don't know. I think that's stupid. I have booties in my face all day and I don't smell anything. I'm like this massaging their back. I don't know.
Exactly.
I don't think that's true.
Exactly. That's it. That yes, exactly. I don't see it either. I don't see
I will say there's a lot of false information out there that people just say. I would say if you are healing, I don't know, don't Google things.
Exactly. Don't Google things.
It's so hard to really get really adequate information and the right information. And sometimes it can stress you out when you hear all kinds of things. And you have to remind yourself everyone heals differently. Not everyone has the same experience.
Exactly. And for question number 2, if you have any advice to give to your younger therapist self when you were first starting out in the plastic surgery therapy world, what advice would you give your younger self?
As far as pertaining to just the cosmetic world and everything.
Yes.
I really feel that maybe educating myself more, reading a lot. It took me a while to find what I really wanted. You got to find what you're good at. You got to find what you like to do and be passionate about it. And I think that's what happened to me when I started after massage school. I was never consistent because I hated relaxing massages. I hated spa massages.
100%.
And I was never consistent because of that. And I never realized there was so many different approaches and so many different modalities you could focus on and specialize in. It was just finding that you really liked and what's for you, you know? If it's for you, it's for you. If it's not for you, just if you and you just know when something's for you and it's not. And I feel like you can't force something that's not.
No,
You have to be able to really love what you're doing and like what you're doing, especially when you're touching people, people's energy and healing people. I feel that you really have to be, genuine and compassionate about it and really know what you want to specialize in. And I think that that's where I felt in that I did love touching people and I wanted to help people. I just wasn't probably informed or I wasn't finding what I was really good at and, finding other approaches to, knowing the lymphatic therapy and everything because, back then in 2010, let's also have in mind that no one was open about plastic surgery. When I had my surgery, no one talked about it. It was hidden. No one talked about it. No one admitted to it. There was not information about it at all that, not even lymphatic massages people talked about or, no one knows, but lymphatic massages have been around for a long, long, long time,
Yeah, they have.
So I feel that with, now with social media, everyone, podcasts, everyone trying to be out there more and people are more open to everything. It kind of just expands how people view things and see things and kind of, get a different perspectives and different views.
Beautiful. And for the third question, where do you see plastic surgery in the next 10 years being?
It's definitely evolving. I feel that it's becoming more and more popular. A lot of people are open to it. It's not just a trend, but it's just becoming a thing
Like
where
a way of life?
yeah, way of life for sure. And like I said, I support it 100%. I do see everything changing with post-op care and a post-op protocol and corrective protocol and everything healing and advancing and being more educated where are the patients and the doctors have more knowledge of how important your post-op care is when having a plastic surgery procedure and how important it is and how to go about it the right and corrective way. So I feel that more than anything right now in the plastic surgery world, we're transitioning to really having a good standard set protocol and standards when dealing with plastic surgery patients. So I feel like we have to, kind of bring that expectation for clients. And eventually, with the post op world, I feel like there will be a therapeutic lymphatic school and how to deal with clients and really standardize, dealing with post op surgery clients. So I feel like that's actually something really important to talk about, because he said, she said, that shit, this is that. It's like, well, who's right? And who's not right because there's so many things people saying things and people doing things differently that I feel that that's why sometimes it's so hard for patients to trust you and to patients find a good qualified therapist because everyone's doing things so differently, and sometimes some people are doing things like we spoke about wrong,
Yes.
and it's jeopardizing their results. So
100%.
I do feel that that's definitely going to be changing soon,
I feel that way too.
you know?
Yeah, especially because I think that once we actually have more science-based evidence to back up what we are actually doing, like, and the way that we are doing our protocols and how they're actually benefiting people, and that we have proof and pictures, but not just pictures, but testimony. And that is what is ultimately going to change and
Yeah,
make
so
things go further in the
for
next 10
sure.
years.
Definitely doctors are now more open to it.
Yeah.
And they've also learning the importance of lymphatic drainage has become more popular. Also, within our scope of practice and everything with massage therapists, I feel that they're going to be pretty much creating a whole school for creating more of a classes for post-op care clients and being adequately knowledgeable to treat the client, because not because you're a licensed massage therapist means you're qualified to treat a post-op client when you have no knowledge on how to go about it and how they're feeling.
100%. Ha ha ha. Yeah, like you can't just be a licensed massage therapist and think that doing Swedish massage is the same as
Because that's what they teach in
working with.
massage school now. It's
Yeah,
only
exactly.
Swedish deep tissue, and you will not learn lymphatic massage in school.
No.
Not here in Nevada for sure.
Yeah, definitely not here.
So, pretty much standardizing everything and creating protocols and, giving people more advanced education and how to go about it and giving the corrective treatment to them. And that's for sure something that I look forward to.
I love that. So well said, Jess. And so, on that note, I wanted to say thank you so much for coming on the show. It truly is a huge honor. If there's anybody I really wanted to interview, it was definitely you. Just because I love your knowledge. Like I said in the beginning, you truly have helped me what I am and the work that I am doing today. And the last question that I ask everybody on the show that comes on the show, if you have any advice to give to anybody who wants to have plastic surgery, what advice would you give to that patient?
I would definitely say make sure you do your research. Make sure you're looking for doctors. Not only doing the research, but making sure the pictures are good. You're actually speaking and getting a before consult with your doctor. There is no reason why your doctor doesn't see you and speak to you
Yeah.
about what you're going to have done prior to surgery and preparing for surgery.
Yes.
Should have a consult before and know your doctor and kind of talk to them about your expectations. It's not you come in and you have surgery the same day. You got to be very careful
Exactly.
and who you
Yes.
choose. Do your homework and also look at the pictures, and ask questions. Ask a lot of questions. I ask a lot of questions.
Yeah.
Sometimes, it's good also to, I heard there's like Facebook groups where people talk about their different experiences as well as how the doctor was and how they were treated, look into things like that. But definitely do a lot of research, because not all doctors, although they're qualified, or there's places here in Vegas that tend to perform surgeries, they're using doctors that are not legitimately plastic surgeons. And you have to know where you're going exactly. You have to be really careful.
Yeah.
Sometimes you go somewhere, you want to look good, and you end up having a problem, and now you have to fix something because you perhaps, made the wrong choice or you weren't patient about it. So just take your time, be careful, and do your research prior to choosing.
Thanks, Jess. So well said. Thank you so much for coming on the show.
Thanks.
And as always, like, share, subscribe, hit the push notifications for all things Talk Plastic Surgery. Bye.